So my name is Dev Sharma and I'm from Rajasthan, and currently I'm in the 6th year and first semester student. I have transferred from Ukraine in my 4th year, and it's been like I'm studying in Avicenna for the last 2 years. It was a huge shift for me because there they don't have any credit system and they are morely focused on the theoretical part. But here it's completely practical. You have, as we already know, Avicenna have their own 5 hospitals, so they have like vast of the clinical experiences. We have internship, we have extracurricular activities, we have research paper. Like there are many such things that was different from Ukraine. But I really like here as a medical student, I would love to be more part of the practical. And even as for the mannequins and everything, like the university brought a lot of like high class mannequin, like in which we can choose any disease and they will show the that symptoms, and it would be easy for to diagnose better than to working on the real patient, because in real patient you can't have the same experience again and again for the practice. But here with the mannequins you can have the same experience again and again, and it would be really easy for them to grasp the thing. Even for me, like I have taken parts in like many surgeries. Like I have taken part in like the major surgeries of the tumor removal. I have taken part in the surgeries of umbilical. Not just taken part, like they also help us to like the scrubbing in the surgery to help them to be the association of surgeon. That was a really wonderful experience, because as we know, each and every medical student have their dream to be in the part of surgery, not just observe it from the outside, but like to own handle surgery. Like that was a really wonderful experience that I've experienced where I come in Avicenna. And moreover, it's not hard to settle there because the environment is really good. Like we also get the sea, we also get the mountain, and most of the time it's like windy here, so it's not like that's really cold or really hot. The food here is really good. Like even we have a lot of veg options and a lot of non-veg options if you have both. As it is a tourist country, so you get a lot of good cafes. Like the old Batumi is famous for the cafes. Like you can find any type of cafe if you want, like Korean food, Japanese food. If you want to try any new dishes, it's huge. Like each and every street you can find a new cafe with a new theme, and like I really love that. And as for the university, like they have really good infrastructure and the staff is really supporting. Like you can ask them anytime, and even they try to help us as we are far away from our country. Like they organize holy parties. Like last holiday was a really good holy party, and it was really fun. They tried to make our culture blend with our culture. So I think it's really good. Like when you're such far away and you celebrate some festival, it's like a recharge, so you can study more. Moreover, like if you want any help with the library, they help with the library stuff. You can get any books from the library. They have a really good library, and they've also have e-library on their LMS system. Yeah, one more change like I've seen there is the LMS system. Like we have to give exam on a computer basis. Like that's an MCQ. Like for the final exam and the midterm, you have to give on the MCQ. And the talking about when I was talking about the internship, like it was not in our syllabus, it was just freely provided by the university. That is for the trauma, as each and every student know, we can face trauma at any point of our life. We can have trauma patients. Trauma is the main thing. Like each and every doctor should know like how to handle a simple trauma. Like it can be a basic injury, basic accident. So they have given the clerkship option for like 75 hours, and it was a night shift, so that was also a new experience. And it was for each and everywhere from first year to 6th year, so it's not just like it's for the 6th year also, it was for the first year too. So they know the basics of the how to manage trauma and how to manage the emergency medicine. Like even at any point of their life, when they are like, if they find something like emergency, they can at least manage the patient, so they can easily transfer to the hospital. They can know the basic first aid of the trauma and how to identify the basics, is the patient is highly critical, is the patient is movable. So the basic triads of the emergency department, it was to teach on us for the deck. Other than that, like there are many good things. Like our university is based on hospitals. Like total of there are 5 hospitals which you can practice, like Med Center, Solo Med. There was Pub Med, and there was different. Like all the 5 hospitals are with the latest technology, so you can find each and everything. Even in our university on the first floor, you can find the machines like the CT scan machine, and it's good for your radiology knowledge when you want to study about the radiology, and you can see them clearly and attend classes with the doctors.